Hi everyone, I am Leah May Villena from BSN 1201 and for today I will be demonstrating proper hand hygiene or hand washing using a regular soap or an antimicrobial soap. So the first thing to do is to stand in front of the sink. And then assess hands for visible soiling, breaks or cuts in the skin and cuticles. Because those areas are where microorganisms grow and we need to give extra attention to that part. And then assemble the equipment. So make sure you have your antimicrobial soap, your hand towel, or your tissue paper with you. So make sure that those equipments were within our reach. Then remove jewelry and watch and push long sleeves above the elbow, and our uniforms must not touch the sink. So our uniforms must not touch the sink. It makes our process easier for us to wash our hands. And then, open the faucet and adjust water to appropriate temperature and flow. This will prevent the chopping of our skin and will prevent the splashing of water into our uniforms. Then wet elbow down to hands first under running water. So keeping our hands down lower than our elbow. So the water must flow from the elbow, which is the least contaminated area, and then apply appropriate amount of antimicrobial soap and lather hands. So if bar soap is used, wash soap and lather hands, and if it is accidentally dropped, repeat the procedure. Return the bar soap on the soap dish without touching the sink because the sink surface is a very contaminated area. Wash hands properly for at least 20 seconds, keeping fingertips down. Following the World Health Organization's protocol, rub hands palm to palm. 1, 2, 3, 4, 5. Rub back of each hand with the palm of the other hand with fingers interlaced. 1, 2, 3, 4, 5. And 1, 2, 3, 4, 5. Rub palm to palm with fingers interlaced. 1, 2, 3, 4, 5. Rub with backs of fingers, so opposing palms with fingers interlocked. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Rub each thumb clasp on opposite hand using rotational movement. 1, 2, 3, 4, 5. And 1, 2, 3, 4, 5. And then rub the tips of your fingers to opposite palm in circular motion. 1, 2, 3, 4, 5. And 1, 2, 3, 4, 5. Rub each wrist with opposite hand going up to the elbow area. 1, 2, 3, 4, 5. And 1, 2, 3, 4, 5. And then rinse elbow down to hands, keeping hands lower than the elbow. So again, water must flow from the cleaner area down to hands. So elbow first. Elbow first. Elbow first down to our hands. So always keep in mind that hands must be lower than the elbow. Okay, and then using your hand towel or your tissue paper, turn off the faucet and then discard the tissue paper. And then, because we use the tissue paper to turn off the faucet because the faucet is a very contaminated surface. And then, dry our hands thoroughly using a hand towel or a tissue paper. So starting from the fingertips, then the hands, wrist, and then forearm. Then vice versa. And then discard the tissue paper. And then, the next step to do is applying lotion to keep our skin soft and lubricated. But applying lotion is optional. And then for the last step, inspect hands and nails to ensure cleanliness. So, that would be all for our hand hygiene or hand washing. Thank you for watching.